Thank you so much for all the prayers. Patapos na the surgery ko and
trying to stand up and walk. My god, this hair is a mess. Oh my god. This is my catheter bag and I'm trying to move slowly because it feels yan, sarap. Guys, Lars here and welcome back to your channel. Yes, and it's been a month after my SRS surgery. And for this video, I'm just gonna share the whole experience and what I am feeling now. So I'm gonna try hard to speak in English so that global audience will watch this video will understand. So don't bash me and don't judge me because I'm not a perfect English speaker. So, inuunahan ko na kayo, guys. I had my surgery last July 29, 2022, and it's now August 31. So, it's been a month and 2 days after the surgery. And I would just like to, look back on the hardships that I've experienced. But all of it is so rewarding. I've been admitted at the operating room at 1 p.m. and I woke up at 8 p.m. So it has been 7 hours surgery and I was just like, when I woke up, I've been chilling and I'm feeling so cold. And I asked the nurse to give me something warm. So when she put I think it's electric fan that release warm air, I fell asleep again and I woke up at 9 and I immediately asked the nurse to, put me back in my room and I want to see my friend. So in there, I called my dad, my mom, my sister, and I was just like crying, telling them, finally happened, wala na, tapos na, kompleto na yung pinaka pangarap ko. So iyak lang ako ng iyak. And then 11 p.m. nakatulog na ako. On the first day, I don't feel any pain on the surgical part. All I feel is a pressure inside my stomach. So I asked the nurse to give me something that will ease the pain. And I asked her, is it normal to have that pressure down there? And she said yes. On the first day, it was like 6 out of 10 pain. I can't move, I can't find a perfect position to sleep, and what's the hardest part is that my back is so numb and I can feel anything there, so I'm just having a hard time sleeping. The first time I get to see my pussy and I was just like crying and I said, oh, this is my dream, you should be there when I was born. And it was like so swollen and there's a bandage and there's a catheter, but I just feel so happy that time seeing it. And I asked the nurse, can you take a picture? And I just wanted to see it. The nurse said, is it okay because it's swollen, it's totally messed up? But I said, yes, please take me a picture. And I was like, oh my god, oh my god. Yeah, so we move on the stay. I was discharged from the hospital and I transferred to the hotel. In the hotel, there is a clinic and in there you'll do your dilation. And I was so nervous because I know it's a 1 and there is still some pain in that part and you have to dilate it and you have to penetrate something inside it. So I was like nervous, but when I get to the dilation room, I was just like praying and I was just like relaxing myself. And when they inserted the dilator for the first time, I didn't feel anything. There was a pressure because I can feel it going inside me, but it was like 1 out of 10 pain. And I don't think everybody could experience it because the other room that I have been hearing, she was like almost crying. I was like, oh, but I didn't feel any pain. So I guess she had other technique. So I have had the PPV technique, and I've asked the nurse, is it normal that I don't feel any pain inside? And she said yes. So different techniques, different pain that you'll experience. Okay, on the 7th day, this is the worst because you have to remove your catheter. So they removed my catheter, and for the first time I peed, and it feels good peeing on your pussy. Like, oh my god, this is such a goal that I should be not standing up, and I should be like just perfectly sitting down there. But when I get back to the hotel, this is the worst because I can't pee it all. It can just go out all the way. So I'm having a pain in my stomach and feels like all the water and all the fluids inside my body is in there, and I feel like I was bloated. So yeah, there is a problem. I'm having a hard time peeing. So they put my catheter back, and I was just like, oh, it's painful. It's painful. And yeah, they put my catheter back, and it was like in there for another 3 days. So on the 3rd day, I drink lots and lots of water, and yeah, thank God, because I peed normally after removing that. So that is one advice that I will give you after your SRS. You have to take lots of water. Lots of water, and you have to hydrate yourself. I've asked girls who've done their SRS, and they said yes, that's the hard part. The hard part is peeing. And now I pee normally, so thank God everything is going well. Also, what I like about this journey is for the first time that I saw my vagina, it was swollen. But day after day after day, the swollen part subsides, and you'll get to see it. You get to see it, the natural and normal features of it, and I was just like, oh my god, I love it. I have a vagina. I am a woman since I was born, but this completes me all the way. So I'm just so happy. Yeah, so let's move on the dilation part. So we have to dilate like for 2 times a day, 1 hour. And for the SRS PPV technique, we just need to do it for 6 months. And after that 6 months, you can dilate at least once a day or thrice a week. So it's not a lifetime experience. And I'm gonna show you the things that I'm using in here for my dilation. Yeah, this one. So this is the mirror that I need. You need to use this so that you could see there. This is the dilator number 1. But on September 5, I'll be moving on to number 2. That's much bigger and wider. This is the douche. You need it, and you have to make sure that this is clean. And this is the cream that you have to put it so that the other swollen part will subside, and it's also antibacterial. So yeah, these are the things, and these are my best friend for like 6 months. After that 1 month, I've been more confident with my body. I've been more confident with what I wear. You know, I'm just good vibes every day, knowing that I have it already. Now that I have it, you know, I can wear fitted pants, leggings. That's what I dream. I have lots of leggings, but I don't wear them because, you know, it's so hard to talk all the time. But now that I don't have to talk anymore, I can wear them all the time. So yeah, this journey was a little bit hard at first, but it is all worth it. It is all worth it. All you have to do is to pray and to condition your mind that after the surgery, your life will be changed. And I can see the changes now because there is a responsibility, of course, the dilation, your hygiene. Tell everybody that is watching that after this, the way you see the bathroom is so different. I mean, I was like always carrying alcohol with me, and wet wipes and a tissue because I can't sit on the bowl that is wet. I feel like the bacteria is gonna enter it, and I was just like so maarte. I was so sobrang arte ko pagdating sa CR. Yeah, So as of this day, I'm feeling fine. I'm feeling okay. It's just that I can still, do things normally like I do before. When I sit down, I have to sit down slowly because still there is a pain. There is a pain that I can feel, but I can say that I'm totally fine. It's just that I'm not allowed swimming for 2 months, which is what I usually do. I always go to the beach, I always go to the swimming pools, and I would just like to go swimming, but I'm deprived for 2 months. And all the things that you have to always remember is that drinks lots of water, most especially post-op trans women are prone to urinary tract infection. So yeah, that's what you have to watch out for. But all in all, I'm so okay, I'm so fine. And yeah, I was just like to do this video for you guys. I know all of you have lots of questions, so you can comment on the comment section. And yeah, that's all for today, I guess. Yeah, I hope you enjoy this video, and don't forget to like and subscribe, share. Love you all.